Lol. I'm being a crazy person like usual, but hey, we get through the day, and y'all know how I am. So, okay, yesterday I have forgot a very important topic to touch on because I was going off on a huge raving tangent. So, hi guys, how are you? Hope you had an awesome day or awesome night wherever you're sitting at on the side of the world or spectrum or whatever alien planet you're sitting on. Anyway, this is actually a good topic to be on because people that know me, not aware if I've touched on it, um, here and there and everywhere I've spoke on it, that I was a healthcare provider. I did it for over 15 years. Um, I took care of my grandmother. I was going to do it for my mom, but I decided to let my oldest son do it as his first time job. The reason why I stepped in and decided to do healthcare for my grandmother, um, this is where it kind of gets work. But I'm not going to do a tangent. I'm not going to do a rant. Um, I noticed that every time we went to go visit my grandmother to take her out, this is where she was living at. The apartment is called Golden Haven Apartment, and it's right across the street from the Social Security building, like from where she lived. And that was assistant living. It's a senior citizen home, and which they didn't, I don't know why they called it assistant living because they didn't have people there to assist the senior citizens. So where I was talking yesterday about, you know, you don't have to get qualified to be an assistant living, like tested. We just went there, said, hey, she needs an apartment. She'll have healthcare providers for her because she does need assistant living. They're like, okay, fine. And they let her move in. There was no testing, there was no qualifying things. We told them that she had a dog, which was a little chihuahua. I think she had to pay like $150 deposit for, Bonita. But that was pretty much it. She didn't have to do no qualifying exams or get a health check or be put in a hospital to get examined or anything like what my aunt was doing to her when she was in El Paso, Texas. So, um, when she was at Golden Haven, every time we went to go visit her, the floor was sticky from her urinating on it because she had incontinence. She would just wear regular underwear. She would not wear her Depends like she was supposed to. She would boo boo all over the place. That would be very unhygienic for her, especially her being severely diabetic. She was type 2 diabetic. Um, and there's cockroaches everywhere. I would notice if I would pick up the rug, there would be like the girls would attempt to sweep, they would sweep everything underneath my grandmother's rugs. I got to the point, my grandmother, she goes, Tab, if I ask the place that is hiring these girls, because she went through like 5 to 6 girls already at the current time, and I was like in my early 20s, and this is before, at the time, no ankles are broken, nothing was, I was in perfect condition. I had actually lost a lot of freaking weight. I was down to almost 150 pounds. I was like, yeah, buddy. I was walking every day. I was working out every day. I was drinking water every day. At the time, I was still currently smoking. So I didn't have my scare. My mom didn't have her heart attack at that time. So, you know, things are kind of okay, but not okay. You know what I mean? We were kind of like teeter tottering like this on, the scale of, but we're not talking about that. Now we, my grandmother had called, my mom had called, they had mentioned it. They were like, yes, get her in. They got me an application. I filled it out. They hired me just like that. Um, they really didn't care that I didn't have experience with, in the business, but I had, you know, been trained, weirdly enough, by the VA since I was a kid, because I had been through a lot of seminars, being young, because they have given me diabetic training. They had given me a lot of CPR training. They had given me a lot of training, like if anything happens, just in case your grandparents fall, if your grandparents have a heart attack, if your grandmother, she needs her shot, if her, sugar's too high, if you need to get her orange juice, if you need to give her a sugar tablet, if you need to make sugar and water, if there's like icing, they taught me different tips and tricks on how to take care of her, since I was home alone with my grandmother a lot. So I had a lot of they started training me since I was 7 or 8 how to take care of my grandmother. The VA did. I went to a lot of her training classes with her, and this is what they taught me in El Paso. So this was at Fort Bliss at the VA there. And so I got trained by professionals, and this was out there by big wigs of Fort Bliss Hospital. So my grandmother mentioned that, and the healthcare place that I worked for was like, hell yeah, we'll take her. And so when they started noticing how well I worked, when they came in to check my grandma's apartment once I started working, they're like, can we give you more clients? I'm like, they noticed a change in my grandmother's appearance as soon as I started coming over there. My grandmother at first was scared to take a bath. I got her in that bathtub. I got her sat down. I started picking her up. She was scared that I wasn't going to be able to get her in and out of the bathtub. I did. Um, I actually lifted her. She was quite shocked. I'm like, trust me, I got you, Grandma. It ain't nothing. And she's like, oh my gosh, I'm so heavy. I'm like, Grandma, I weight lift over 300 pounds. You ain't nothing, honey. Okay. I'm like, please, I pick up heavier things than you. I'm like, you're not going to fall. You acting silly will make us fall, but just trust, have faith in me. I know what I'm doing. So, Girling Healthcare, where I worked for, really wanted me to take on more clients because they seen how well I was adverse in taking care of my grandmother. Now, it being my grandmother, I could go above and beyond because it was my grandmother. I was comfortable in bathing her. I was comfortable in cleaning up the urine, the fecal matter, the blood. If it was somebody else's blood and possibly urine, if I was mopping it, that would be one thing. But cleaning up someone's fecal matter, that would kind of gross me out to a little bit. But the thing is, when I started telling them, like when I was taking extra time, I needed more time, I needed more pay, they needed to pay me more, I needed more hours because the girls weren't doing what they needed to do. And I had to use a lot of chemicals. I had to deep clean and everything else. They go, no, you're only supposed to use soap and water. That's it. Soap and hot water. This is what they tell workers. Soap and hot water. That's all you're supposed to do. You're not supposed to really go above and beyond. And then sit down and talk. That's it. And I'm like, okay. And then if anything else goes on, it's on my terms. It's after hours and I'm supposed to clock out. If I do anything above, it's on my time. They're not going to pay me overtime. And see, this is with healthcare. And I'll tell you what the definition of healthcare provider. Okay, guys? I pulled it up so I can give you all the definition of it. A healthcare provider is an individual health professional or a health facility organization licensed to provide healthcare diagnosis and treatment services, including medication, surgery, and medical devices. Healthcare providers often receive payments for their services rendered from health insurance providers, and they have a Wikipedia on it. What else? In the United States, the Department of Health and Human Services defines a healthcare provider as any person or organization who furnishes bills or is paid for healthcare in the normal course or businesses. Individual providers. In the United States, the law defines a healthcare provider as a doctor or doctor of medicine or Austin osteopath who is authorized to practice medicine or surgery by the state or anyone else designated by the United States Secretary of Labor as being able to provide healthcare services. In general, this is seen to include a physician, a professional who practices medicine, that advanced practice provider, a trained health worker who has defined scope of practice, aligned health profession, a non-physician clinic who delivers healthcare services, a health professional, any person involved in the delivery of healthcare. Institutional providers. A hospital network, an organization that operates multitude hospitals and clinics offering comprehensive health care services. So it goes on to give you more information about healthcare providers. So that's the definition of one, the healthcare provider. And I rendered a lot of services for my grandmother. I would give her medication. I would feed her. I did her skincare routine. I did her hair care routine. I did her nail routine. I did her exercise regimen. Um, I would have to clean her doubly because of her incontinence, because she did, like I said, she did urinate on herself. She did have the fecal matter. Then I would have to handle the insulin. Because she would have her diabetes. Because like when we started taking care of her, my mother and me, well, it was more me because my mom really didn't handle her too much. So to be honest, I'm the one that did a lot of the stuff dealing with her diabetes, because anytime that things would start happening, I would get a phone call at God knows when, because it would be all hours of the night. I'd be like literally on call, like like a RN or an LVN. I'd be like getting a phone call from Karen, hey Tab, guess what? Come on over. Grandma's bottoming out, or grandma's sugar's too high, and she's over here freaking out that her feet is going crazy, and she wouldn't like her feet to be propped up when her sugar was too high or too low, because you get really bad neuropathy. And I'll explain to you what neuropathy is. If a lot of you are not aware what neuropathy is, hang on one second. I should already pop that up. Neuropathy definition. Okay. Neuropathy, neuropathy, pain in feet. We'll say neuropathy in feet. Neuropathy. Okay, here we go. I found it. Um, neuropathy, painful foot neuropathy. Here we go. Here we go. Since I found the right one, we can just put neuropathy definition. Okay. It is a peripheral neuropathy. It's a result of damage to the nerves located outside of the brain and spinal cord. Peripheral nerves often cause weakness, numbness, and pain, usually in the hands and the feet. It can also affect other areas of the body functions, including digestion, urination, and circulation. I didn't even know it affected urination. Oh my God. Okay. So that could have been another reason why she had incontinence. I had no idea. So I just learned that. And digestion, I had no idea. So that could have been another thing that was affecting my mom's digestion, because she had a lot of problem with digestion, and I didn't know that neuropathy affected that. Um, your peripheral nervous system sends information from your brain and spinal cord, central nervous system, to the rest of your body. The peripheral nerves also send sensory information. Hang on a minute. Sensory. Which I'm giving you all this information, like I said in my clip note thing that I put at my information part. I'm giving you all tons of information so y'all can get informed. The central nervous system to the rest of your body. The peripheral nervous system also send sensory information to the central nervous system. Peripheral neuropathy can result from traumatic injuries, infection, metabolic problems, inherited causes, and exposure to toxins. One of the most common causes is diabetes, which that's why we have it. People with peripheral neuropathy generally describe the pain as stabbing, burning, or tingling. In many cases, symptoms improve, especially if caused by a treatable condition. Medications can reduce the pain or peripheral neuropathy. So, they say that sensory nerves that receive sensations such as temperature, pain, vibration, or touch from the skin, that's one that you get from it. Motor nerves that control muscle movement, which I have neuropathy evidently in my eyes because my eyes twitch constantly. Motor nerves that control muscle movement, which I have constant twitchies. Um, on autonomic nerve that control functions such as blood pressure, perspiration, heart rate, digestion, and bladder function, which I didn't know about bladder function. Sign and symptoms of peripheral neuropathy might include gradual onset of numbness, prickling, or tingling in your feet or hands, which can spread upward into your legs and arms. Sharp jabbing, throbbing, or burning pain, extreme sensitivity to touch, which my grandpa had neuropathy in his feet, so they never really put my grandpa as a diabetic, but my grandpa had severe neuropathy in his feet. And they were swollen and he had bumps all over him and it was really horribly bad. I felt so bad for my grandfather. Pain during activities that shouldn't cause pain, such as pain in your feet when putting weight on them or when they're under a blanket, lack of coordination and falling, muscle weakness, feeling as if you're wearing gloves or socks when you're not, paralysis if motor nerves are affected. If autonomic nerves are affected, signs and symptoms might include heat intolerance, excessive sweating, or not being able to sweat, bowel, bladder, or digestive problems, which I know exactly two people that in my family that's definitely right on the nose is my grandmother and my mom. Drops in blood pressure causing dizziness or lightheadedness, my grandmother and my mom. Um, Peripheral neuropathy can affect one nerve, mononeuropathy, two or more nerves in different areas, multiple mononeuropathy, or many nerves, polyneuropathy, carpal tunnel syndrome, which I have in both my wrists, is an example of mononeuropathy, which I got carpal tunnel syndrome. This one on my right hand, I got with Adrian. My left hand, I got with Alex. Um, Most people with peripheral neuropathy have polyneuropathy. Seek medical care right away if you notice unusual tingling, weakness, or pain in your hands or feet. Early diagnosis and treatment offer the best change for controlling your symptoms and preventing further damage to your peripheral nerves, which they only offered me surgery. And I'm trying to lose any type of, you know, motor, sensory with my hands because Alex had a teacher, which was one of his close teachers that had hand surgery, and she constantly talked about having weakness in her hand. So I'm not too hip on it. Only thing I might get surgery on is my collarbone, maybe, and my shoulder, because this over here is since I fell in the backyard when I mentioned that I went out there when Karen kept pushing me to go outside to water those stupid plants, and I fell in that ghost hole and I had to literally crawl, like army crawl back because I broke my ankle and my ankle, and then I found out my two shoulders. It was horrible. But anyway, that's the only surgery I might get next is this one and my tummy if they allow me to get that because I keep having issues, and Lord willing, if it is an issue, they allow it. But next, those are the two things was the neuropathy and the healthcare provider issues. Now with healthcare providers, um, it's very hard to pick and choose when you're dealing with healthcare providers. I tell you guys this, um, they prefer to have elderly people at home. I have noticed that a lot of places they don't like people in nursing homes. Now, I will agree. If someone is 100% healthy, they're in their coherent mind, they can actually take care of themselves, they're pleasant, they're not causing issues, um, they're okay, their moods are easy to get along with, they are not causing any type of disarray with anybody. Okay, I don't, I feel like long as, they're being okay out in the open, I feel that it's fine. If there's no mental problem or anything like that and they're stable, I feel that it's okay to leave them out. Because, like my mother in law, she's up there in age. She may have a little depression because my father in law just died. She has every right to have depression. Okay. Me having depression like I do, I should not have depression like I do. Okay. There's no reason for someone at the age of 41 to have the PTSD level I have, to have the depression level that I have, to have the anxiety level that I have. No one at my age or even younger than me should have the level that I have. I mean, I'm to the point that leaving my home, I don't even want to leave my house really. Only time I want to leave my house is when I move. And maybe once I move, I'll feel better. But I'm to the point I don't even want to leave my home. And that my friends is it's sad. It's really sad. Cuz there's a bunch of crazy people that I know that I don't trust, that I'm fearful of, that they've got me where I don't feel safe. Especially comments that they've made me very uncomfortable. So, yeah. Now, moving on from that topic, because I said we're not going to get on that topic, and we're not, and I keep my word. We're going to talk where I was talking about the healthcare providers. Now, the healthcare providers my grandma had before me, they actually took care of my grandmother the way that the businesses allowed them to, and I feel that it's wrong. I feel that they should have took care of my grandmother the way that I did. I went the way that they should look at my grandmother the way I look at every elderly person. Now, if I would have gotten more clients, I would look at them like I would my grandmother. I would look at them the way I would my grandfather. I would treat them all with respect because that's how my grandparents raised me. And I know a lot of people was not raised with God-given good sense the way I was. I was raised very old fashioned because I was raised by very, old Southern people. I was raised by someone that was born in 1921, 1919. So I was raised with people that had very old school values, very old school, perceptions. So when I see someone elderly, I automatically want to help them. My heart goes out to them. I see grandpa, I see grandma. I automatically, like, even when I'm doing my job, if I hear someone old on the other line, I automatically smile and I automatically start talking to them, and I have a good conversation with them, and I it's just that part of me, it tugs on my heartstring. And I even told my bosses, I said, I'm not going to be rude to an elderly person. You could try to fire me. You can't pay me enough to be rude to them. You could threaten me as much as you want to be rude to them. I'm not going to do it. Now, if they're rude to me, I'll take it. Now, if it's someone my age that be rude to me, I might get snippy. But if they're older, like much older, like in their 60s, 70s, and 80s, I won't. Now, people are going to be like, well, you got snippy with your mom. That was years, guys. That was years of it that I put up with, and I finally had enough of it. So that's a different line, straw, peak, and horse, and balloon, and hot air balloon, and ice cream, and rolled up joint, rolled up cigarette, rolled up bong, and everything of the color that you want to call it. Okay, that's a whole horse of another freaking color, and barn and house and mansion and castle and everything all together. Okay, and trust me, I didn't disrespect her as much as I should have. I should have literally grabbed her by her hair, kicked her ass, and threw her out like the bum she should have been. But I didn't. Are you okay, Kat? Okay, I was wondering if you were over there hurling. I was about ready to run over there and grab you. Ah! Sorry, my daughter is eating undereat chicken and I'm getting scared.
I cooked it all the way though.
Baby, she's over there spitting and about ready to hurl.
It is.
Baby, that's no bueno. Okay, so anyway, I wasn't going off in a tangent. I was explaining something before everybody goes whatever, whatever, whatever. If I'm talking to a person for the first time, they get certain strikes, is what I'm saying. Now, if someone has done it over and over and over and over and over, and I've given them so many get out of jail free cards, I can only take so much. You know what I'm saying? I'm only human, and I ain't gonna take so much abuse. You know, I can only get slapped in the face so much. You know, it's like you can only punch a dog in the face so much until that dog's gonna turn up and get your throat. You know, that's all I'm saying. I can ravage when I've had enough of getting hit. And that's what happened to me. It's only natural that I finally had enough. I love the woman to the day I'm going to die. I just can't stand the individual she turned into because she didn't want to take the correct help. And this is leading, where help needed to be supplied, but it never got supplied because my grandmother got help supplied when it finally got needed, but family was like a bunch of wild flies on shit trying to land on it, annoying as hell, like flies that did not need to land on shit like typical, but it is what it is. You know what I'm saying? So, healthcare providers, as I try to educate some of my ignorant family on it, you take care, and it's why I even try to tell the healthcare places too. They actually underpaid me too. They got almost $20 for me to work for them, and they only paid me 8 something, 7 something. I got undercut massively. And I was supposed to be getting raises yearly. They weren't giving me raises. They were actually told me, this is the kicker too, guys. They were actually supposed, at the time I was getting food stamps, they were supposed to report to the food stamp office that I was getting food stamps. I actually gave them the paperwork. I went to them and asked them, can I get the paperwork so I could go turn it into the food stamp office so I don't get in trouble? They go, oh no, we're going to fax it to them for you, sweetheart, because we're supposed to get a credit for you being on food stamps. We actually get help that you're working for us and you're receiving food stamps. So we already faxed it for you. I'm like, okay, can I get a copy of it? They go, well, we already got it filed and we don't got time. And I'm like, can y'all at least try to find it for me, please? Because it was a lady at the desk that I headbutt with a lot when I worked for the company. And I'm not going to mention the company because this company had a lady that my mom's ex actually messed with, and the company didn't fire the whore. So, yeah. So, any mother freaking way, um, I actually got in the company's face because I told them, I said, why don't you let me come in there and work in the office? I can straighten some stuff up. I can actually get these girls to actually work. And I said, I think y'all are cutting corners. I think y'all are doing a lot of, illegitimate stuff. I said, I think y'all, I think this, the Texas board would not allow a lot of things that y'all are doing because I don't think that these clients are undeserving of the things that y'all are telling our workers to do. I'm like, just hot soap and water. That's it. I'm like, soapy floors. I'm like, you at least need floor cleaner on the floor or at least bleach and water. I'm like, you're at least supposed to put 409 on the sink or at least Mr. Clean of some sort. How are you supposed to clean the bathtub? How are you supposed to clean the mirrors? Windex? I said, what are the girls gonna do? Stand there and be like, I'm gonna squirt Windex in my eye. Okay, I'm gonna go get the company for insurance. They're gonna pay me workman's comp. I'm like, really? I'm like, that's why supposedly they were not letting people use supposedly chemicals on the job because they were afraid these dumb girls were going to get workman's comp on the job. I'm like, if they're that freaking ignorant, why do you have them working for the company? I'm like, no, this is a poor excuse to not take care of the elderly. So if you're going to have healthcare providers come in, make sure you question them on, do you allow them to use chemicals when they come in the house? Are they allowed to use Windex, 409, bleach, the Mr. Clean mop stuff? What are they allowed? Are they allowed to use Pine Sol, Fabulosa? Ask them what they're allowed to use to take care of your elderly loved one first. Because if they tell you, oh no, they're not allowed to use no chemicals. We only allowed to use some hot water and soap and things like that. Switch companies, do your research, deep dive into your research, search around, because there's a lot of healthcare places out there for your loved ones that do allow chemicals to be used so the people don't get sick, because hot water and soap ain't going to disinfect shit, especially if you have a loved one that's incontinent or incognate or whatever. Incontinence, yeah, I know that works. I have to ask that question when I do my work every day. Are you incontinence, or do you have incontinence? Basically, if they pee and poop all over themselves and have to wear Depends, um, hot water and soap is not going to disinfect that. And that's going to make a mess. Cockroaches, maggots, all that's going to be in their home. And that's going to be bad. That's not going to disinfect an area. So, that's why if that's what they're doing in nursing homes, that's why when you go in a nursing home, that's probably why it smells as bad as it does, because they're not cleaning it the way that they're supposed to. That's why, check, next I'm going to talk about nursing homes later down the road. Um, check nursing homes before you put loved ones in, because there is a lot of good nursing homes out there. This is why I get mad at a lot of elderly people that throw fits about going to nursing homes. I found at least 8 good nursing homes that I could have put my mother in, and she acted like a rupturing, hemorrhaging duck. That going into a nursing home was such a horrible thing. I found 8 that would have worked with her on her budget, that would have gave her money, would allowed her to work, would allowed her to take some of her stuff, would have minded that she had a small pet, not the cat, but like a small little dog or a small like toy cat or something, like a cat that was smaller than Roman. But they would have worked with her on things, and they were clean. They would allow, her to have an actual aid. They would allow her to actually leave. They would actually give her transportation to do whatever, we would have came and visited her. We would have had some sort of, type of bond with her. Do I have any bond with her no more? No. I'll explain that in another video too when I am more stable to talk about it. Right now I'm not really stable to talk about that. Because I have a lot of unresolved things dealing with that. It's very, I have nightmares. I can't stop having nightmares. I have a lot of bad juju on that. So, nah. Anyway, now dealing with a DNR. That is a do not resuscitate, guys. Now, do not resuscitate. Let me tell you the definition of this. You actually have to sign it first, okay? And it means a do not resuscitate, which is a DNR, is also known as a do not attempt to resuscitation. Do not attempt for cardiopulmonary resuscitation. No code or allow natural death is a medical order written or oral depending on county and indicating that a person should not receive cardiopulmonary resuscitation if that person's heart stops beating. Sometimes these decisions are the relevant documents. Relevant documents. Hang on a minute. Let me finish telling you. Relevant documents also encompass decisions around other criteria of life prolonging medical interventions, the legal status and processes surrounding DNR orders vary From country to country, most commonly, the order is placed by a physician based on a combination of medical judgment and patient involvement. And then it goes based on the whole countries and all that. And it says basis for choice. Interviews with 26 DNR patients and 16 full cold patients in Toronto in 2006-9 suggests that the decision to choose do not resuscitate status was based on personal factors including health and lifestyle, um, relation or relation factors, I guess, to family or to society as a whole, and philosophical factors. Audio recordings of 19 decisions about DNR status between doctors and patients in two U.S. hospitals, San Francisco and Durham. In 2008, 9 found that patients mentioned risk benefits and outcomes of CPR, and doctors explored preferences for short versus long term use of life sustaining therapy. A Canadian article, Diane Jin and David Zittner, Canadian family physician, 1995, CPR, not for all terminally ill patients, suggests that it is inappropriate to offer CPR when the clinic knows the patient has a terminal illness and that CPR will be futile. And there's a whole bunch more information on DNR. Now, my problem with DNR, guys, I have a whole list of issues with DNR now. My grandmother signed a DNR, not aware fully of the full capacity of a DNR. And that article really didn't touch fully either on DNR. They really don't give you the full enchilada sometimes. They don't give you the full plate. Like, they only give you the enchilada, but they don't give you the rice and the frijoles and the soda and, the little salad and the salsa and the chips like they offer you. You know what I'm saying? They don't give you the whole thing. They give you a partial part of the story, which is BS. I'll give you the whole story. Now, my grandma and my grandpa being, well, my grandpa wasn't religious. My grandma was religious. My grandpa was spiritual, okay? But he didn't believe in artificial sustaining life. He felt that if he basically was brain dead, he did not want to be put on like a defibrillator, artificial life, a breathing machine, stuff like that. That's what he was trying to get across to a doctor. Basically, the doctor put it upon himself with my dumbass grandmother, which my grandma, when I say I dumbass, I'm not meaning it to put her down in a foul way or put her down in an ignorant way. I'm saying like a blonde, like mentirosa, ignorant, like she was being a stupid ass. She should have asked questions because this is her husband. This is her best friend. You don't sit here and fuck around with the life. This is someone you love. This is someone you cherish. This is someone that you've been with for nearly 60 freaking years. You don't play with that. You know what I'm saying? This is, this is like playing with your own life, and you don't do that. You take it seriously, because my husband and myself have had these in-depth conversations. Like, I've told him, like, if they mention open heart surgery, if it's not going to be like way up north, I ain't doing it. I don't trust the hospitals around here. I'm not getting myself cut. It's going to be like, you know what? I'll take the alternative. I'll take a short bias life. Oh well, I'll live it to the best that I can and ride this bitch out like a horse, and I'm gonna ride it down to the ground and be like, yeah, bitch. So be it. And do not resuscitate my ass in. Let me go. You know what I'm saying? Because if it is what it is, let it be what it is. I do not want to try to come back unless they can offer me a better chance and make sure that I don't feel no goddamn pain. I ain't gonna be sitting here doing this shit that I don't want to lose my mind like my mother lost her mind. Fuck that shit. I don't, I'm already having to talk to my doctors, and I'm going to be making plans already in advance, starting when I go see my doctor tomorrow. I've already made some plans, but I'm making big future plans because I'm literally in, like I said, when I'm in fear of things, guys, I'm literally in phobia fear. I'm in panic mode. So I've sat down, guys, honestly, cried my heart out to my husband and told him, seeing how my aunts have acted, seeing how my mother has acted, seeing how my cousins have acted, I'm definitely in fear. I think that a lot of this is family hereditary. It is definitely possibly female gene related with the diabetes and the dementia state where a lot of the illness in the mind. I think it's female gene related. And I'm going to ask my doctor. I'm going to talk to my doctor. I'm going to explain why I feel it is. I'm going to have a very in depth conversation with my doctor tomorrow. I'm going to ask if what I'm feeling is wrong. I'm going to ask him to explain it to me. If I have to go to a genetics lab, which I've been trying to get to the genetics lab to get my genetics tested because of my dad and my mom, because there's my dad's side of the family is not, I'm doing ancestry, but it's like I'm finding out who my family is, which I have a pretty cool family background, which is awesome. Finding out I have Bulgarian blood, I have Viking blood. I mean, I have gypsy blood, I have African, I have, Asian, I have Native American, I have German. I mean, I have all this cool blood, but it's like, you know, I need genetics. I need to know more in depth that what do I need to worry about, because I literally seen my mom going crazy like my grandmother. And I'm scared. She doesn't understand. I'm scared. It's like I don't want to do this to my kids. I'm literally trying to break a cycle. That's why I'm being so indifferent. That's why I'm acting like my grandfather with my kids. That's why I don't cuss at them. That's why I'm affectionate to them. That's why I hug them. I comfort them. I am there for them and I'm patient with them. I'm understanding. I'm a mom. I'm at home. I don't try to run from them when they need me. I chase after them, not away from them. And I don't want to eventually turn into someone I don't know. Because I know who I am right now. But I don't want to look in the mirror one day and not recognize who I am anymore. That's a terrifying thought. And I looked at her and I didn't recognize who I was looking at anymore. And that happened when she had open heart surgery. I started looking at her and I didn't recognize her anymore. And that's why healthcare, hospice, nursing homes, everything, it does come into play, guys. And that's why I give you all these informational tips. It's a hard decision. Yes. People definitely hate making these choices. It's a difficult choice to make. A lot of people hate surrendering over their freedom. It's not really surrendering your freedom. You still have your freedom. You still have free will. That's what a lot of people think. I'm giving up my freedom. No, you're not giving up your freedom. Yeah, they might give you a bedtime. Oh, big freaking whoop. Oh, you have a bedtime. Boo hoo. Grow up. You need a bedtime. Because evidently you need sleep because you're old. You need a lot more rest now because you require more sleep because your body is getting rickety. It's deteriorating faster now at a faster pace because you have arthritis, you have all these, health elements now. If you're not 100% healthy, you need sleep. You need to quit sitting here fighting against it and accept it. I mean, you're not out here running, you're not, doing all these workout triathletes and all this other stuff. You're not like, I mean, I knew a lady that my mom went to school with. This woman would play tennis, she would work out. I mean, she was actually like one of the deans. And this woman, she was like Tina Turner. I mean, this woman ran circles around half these kids and she was like 60, 70 at that time. And I'm like, the woman, I idolized her. She was, and she's the one that got me into modeling up there. And I modeled for nearly 3 years up at that college. And she wanted me to be pro. I dropped out because they kept pushing me on my diet. They kept pushing me on I needed to look a certain way. I needed to behave a certain way. I needed to sit a certain way. I needed to hang out with certain cliques. I wouldn't fit in with preppy girls. I didn't like hanging out with just girls. I mean, I wasn't going to wear pink, light green, yellow, and like, these pretty little pink tiaras. That ain't me. That ain't me. That's not my feng shui. That would throw my feng shui completely off and I'd throw up. I mean, thinking about it makes me want to throw up. At that time, I was bulimic and anorexic on top of it. How could you be both? Easy. Very simple and easy. At that time, I weighed maybe 110, if that. If that. I did catwalk. I did photo shoots. I did modeling for different things in El Paso. I could have been Miss Teen El Paso if I pushed for it. But I mean, the school was actually going to sponsor me. They were going to pay for my whole entire sponsorship. I didn't want to do it. And the dean was like, "Why don't you want to do it?" She goes, "You can actually get notoriety. You can get your name out there. You can actually get noticed. You can actually get into what you want to do. You can get into acting at your age. You could be a kid star." I'm like, they're pushing me to be someone I'm not. I'm like, I can't be who they're wanting me to be. I'm going to be fake. I'm going to be selling a fake imagery of who I'm not. And I don't want to go out into the world and sell a fake image. If I'm going to go out into the world, I want to sell my image of who I am. So if anybody does look up to me, they'll like who I am for who I am. And if they do look up to me by any chance for any reason, they'll look up to me for the right reason. I didn't want them to look up to me for some bogus fake reason. Dre, can you pick up that one french fry? Yeah. Ooh, yuck. I'm so sorry. That was so grody. I'm so sorry, baby. So, now hospice care, guys, off of that topic. I don't even know how. Hyperactivity. That's how I got to that topic. Okay. Now, DNR. Let me get back to the DNR real quick before I get to the hospice part. Um, DNR, what they did to my grandpa, he was going into a heart attack. They could have went in, they could have given him a shot to stop his heart attack. They did not have to give him CPR. He was strapped down to a bed at that time. They didn't have to really do no type of, they could have done resuscitation once he flatlined. They didn't offer resuscitation. They just sat there and watched him going into a full-on heart attack and didn't do nothing to help. He literally was going into a heart attack and they didn't even go into the VA room to stop it. Now, if he was at the other hospital, he probably would have gotten some sort of help. But this hospital, they just let him sit there and die. And that was part of the DNR. If you're having a heart attack, if you're having a stroke, basically, you have COVID, you're going to die if you have a DNR. Now, to me, I feel DNR should be more black and white. It should be more clear so people can understand what the hell they're signing. So it could be like, hey, if you're having a heart attack, if you're having a stroke, if you're choking, if by any chance you flatline, we're not going to resuscitate you. We're not going to do nothing for you. You're going to die, type of thing. So people will be like, okay, I don't want a DNR. Or, yeah, we'll get a DNR, or a good time to place it. But it doesn't read so clearly. It's very all over the place. It's like they want to go ahead and hurry up and kill you when you sign it. So once you sign it, it's pretty much you signed a suicide letter. It's a free suicide letter. It's what it is basically. And so don't do that if you want your loved one to have a chance, is what I'm saying. Because DNRs are very dangerous. And if you want your loved one to have a chance, like if they're having a heart attack or anything like that, do not have a DNR. Just tell them, I want every chance for them to have at life, but I don't want them put on, anything to sustain them if they have no brain function. Because I feel that if they have, to me at least, if there's no brain activity, then they're gone. Like if their brain is just basically flatline, let them go. Because the brain is literally one part, one major key element is literally like the seed of the tree. It's the one thing that feeds us. It's the one thing that pretty much operates us. It's like the hard drive of our body. If this thing goes out, we go out pretty much. It's like our brain and our heart are the two key elements that we need to operate this whole entire contraption. It's like it's the main aliens in our body that help us go whoop, whoop, whoop. If one goes out, we're goners. Hello, unknown. um, so basically, if the brain goes out, I feel that, that's the best time just to go ahead and say, you know what, just let them go peacefully. And that's when it's a good time to bring in hospice if you're afraid that if you're letting them go. Hello, me daughter. Um, that's the best time to bring in hospice. Um, back kale, basically, right? Back see, back see, Kaylee, basically, right? I guess so. It's hard to read what you wrote. um, so yeah, that's the best time to bring in hospice. So if you're what I was saying is if you're worried that you're gonna hurt the body, if you're worried that they're gonna feel any pain, that's when hospice care is a good time. And I can explain to y'all what hospice is. Hospice care is a type of healthcare that focuses on the palliation of a terminally ill patient's pain and symptoms and attending to their emotional and spiritual needs at the end of their life. Hospice care prioritizes comfort and quality of life by reducing pain and suffering. Hospice care provides an alternative to therapies focused on life prolonging measures that may be odorous, like to cause more symptoms or not aligned with a person's goals. Hospice care in the United States is largely defined by practices of the Medicare system and other health insurances providers, which covered inpatient or at home hospice care for patients with terminal diseases who are estimated to live 6 months or less. Hospice care under the Medicaid hospice benefit requires documentation from two physicians estimating. Now, let me move this because I got in my way. Estimating a person has less than 6 months to live if the disease follows its usual course. Hospice benefits includes access to multidisciplinary treatment teams specialized in the end of life care and can be accessed in home, long-term care facility, or at the hospital. I will in a minute, baby. Outside the United States, the term tends to be primarily associated with the particular buildings or institutions that specialize in such care. Such institutions may similarly provide care mostly in an end of life setting, but they may also be available for patients with other palliative care needs. Hospice care includes assistance for patients, families to help them cope with what is happening and provide care and support to keep the patient at home. So basically, what this does, because I had hospice too. Um, yeah. Go ahead. You can ask me a question real quick. I'm done reading. Go ahead. Mr. or Mrs. Unknown, you can go ahead and ask. I'm waiting on you. Well, while I'm waiting on Unknown to ask their question, I'll go ahead and explain some of hospice. Sorry, I had to kill a gnat. Didn't mean to clap so loud. Hospice needs, um, they actually were taking care of my grandmother at the nursing home she was at, because they transferred her from the hospital to the nursing home because she was so bad with the issues she was having, she couldn't be at home. And for her to be at home, it would have been really bad for her because I mentioned she had flesh rotting disease on her bum from a bed sore that she had got from the nursing home that she was previously at, that she was actually getting therapy because when she fell at our trailer, she had broke her hip, she broke her knee, and she, if I'm not, she dislocated her shoulder. So she was getting therapy for all that. And then when she had gotten hurt at the nursing home, she had fell out of the bed. They weren't properly cleaning her. So if I understood what they had told me, she had scratched her bum, she had the bed sores, and the bed sores had gotten so bad it was eating into her, and we saw them, and they were really bad. So that's one reason why she couldn't come home, because they had to care for the wounds, and they were extremely bad. It was extremely flesh rot. Um, and then at the good nursing home that we had her transferred to, um, I started noticing darkness around her foot because they had booties on her foot. It would improve circulation on your feet. So they were circulation boots. If you're never heard of circulation boots, they're really like big boots that they strap on your feet normally when you have surgery or you have a lot of problems with circulation. You normally have it when you're having massive issues and they're really freaking heavy. I had them when I had my surgery. And they're white and they have like, Velcro straps and so when I noticed the darkness on her foot, I went over there, I moved the blanket, my mom was watching me. That's when I noticed the gangrene. Her foot was excessively black. It went literally all the way almost up to her knee. And that's when I pointed out to my mom because my mom didn't notice it. I did. And I was like, Mom, look. And that's when hospice was brought in because um, we got a hold of the doctors. They noticed that there was eternal internal bleeding. It was gangrene. She had poisoning. There was no way of saving her leg. Um, so there was a lot of problems going on with my grandmother that my family was, not being apparently aware of. So hospice really helped out. And when they come in, they normally come in to administrate a lot of pain medication. Normally it's morphine, volume, is what it's doing. My thing is unstable. There we go. Um, as I was saying, it's basically like putting a human being to sleep. It's like that. Like when you put your animal to sleep, it's like that. It's like putting a human to sleep, but slowly. They do it in a slow attempt. So it's like they try to make them as comfortable as possible. So it's like they slowly drift off to death um, that way. And that's when they got in contact with us. The lady from hospice stayed in contact with us. She let us know how my grandma was doing over the course of time. Went and visited her a few times. She asked for her Bible, her glasses, and of course, I didn't take it to her because I thought that was, real silly to take it to her, especially when she was about ready to pass away. Because, like, she really didn't, need something like that when she was that close to death, even though I know that she needed something like that. So I asked them if they could have a Christian preacher go in there, but I made sure I knew which Christian preacher it was going to be because there was one that was causing issues with our family, and that's the one that I really would like to get that church shut down because they have caused a lot of problems in my family. And like I said, they shouldn't be allowed to do crap like that. I mean, they really shouldn't. I mean, they literally manipulated my poor grandmother. Her mind was rotted alone, and she had a lot of issues mentally, just like my mother. And my grandmother had not been in her right mind for quite some time, and religion had twisted her, and they used that to manipulate my grandmother. I mean, they literally almost got my grandmother kicked out of her apartment because my grandmother gave them her rent money order and they weren't even going to give it back to her. So this church is really messed up. And this church should literally be burnt down to the ground, honestly. And the people that, preached at it should have their houses burnt down. So seriously, with them in it. So, yeah. And they have enough of nerve to say stuff about me. Yeah, their son was an alcoholic and he got stabbed behind a bar. Yeah, and they had enough of nerve to say I was going to go to hell. Yeah. Yeah, I'm not the one behind the bar getting stabbed. Because I have a bad attitude. Yeah, whatever. Because I was talking shit to people and behind a bar, called Low Down Dirty Shame. Yeah. Anyway. Uh Sorry guys. It's just that church irks me. It's my reason why the neuropathy and nerves, I'm telling you. Start mentioning it, my eye just starts tinging. Anywho, um mm, okay. Sorry guys, I was just thinking about something. So yeah, those are the top things that I wanted you guys to have information about when having a loved one that you guys are taking care of. Um it's a lot to handle, and it's it is it's a lot on your mentality, and it's a lot on a person mentally, spiritually, physically, emotionally, physically. And a lot of people think it's something easy, and it's really not. And if you do this, guys, don't take it lightly. You have to go in this wholeheartedly, and you need to do your research and, you know, be cautious with it, and just take care of them as best as you can. And then also remember, take care of yourself. Because if you don't take care of yourself while you're doing this, you will lose yourself. And that's what I forgot to do. I actually, put myself on the back burner a lot. And because I was so busy taking care of a million people and a million things, I had stopped taking care of myself. I mean, I have been needing to get my teeth taken care of for over 15 years. And I mean, every time I go and try to make an appointment, I would try to go do this. Oh, I have to go somewhere. Oh, I have to do this. And oh, I'll cancel it because, I have to come last. And it's like, you get made feel like crap because someone's mentally sick. They're not mentally there. And it's like, they don't pay attention to what they say, and they don't, they're not all there. And it's like they act like a child. And, you know, it's very painful, and it's rough, and it's hard, and it takes its toll really hard on you, and it's never easy. People laugh and go, "Oh my god, yeah, I can handle it. It's nothing. It's just an old person." It's like living with the old lady from Legion, and I thought I was done with having a crazy person like that around me. My mother made my grandmother look like an angel. I mean, I never thought I was going to think like that again. But yeah. And the thing is, like I said, I love my mom. I love my grandma. But I will never, ever, 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 ever do healthcare providing again. And I will never take care of another loved one like that. I'll take care of my kids. I will take care of my husband, but I'm never willingly stepping up and taking care of another person again, because it's it's a lot of pressure, it's a lot of sacrifice. If you're not 100% healthy, if you don't have the mind power, if you don't have the strength alone in yourself, you can't. And I'm worn down. I've been broken. I am completely broken. I will admit it. And the thing is, it takes a lot for me to admit I'm broken. And I don't like admitting it because I'm a strong individual. I am a strong woman. I am a proud woman. And to do this sort of thing, guys, I'm telling you right now, to have a loved one live with you that is very old and senile, and that has dementia, that is going to Alzheimer's, that has senile dementia, that has any type of mental disorder, it takes its toll on you. And it is not easy. It is like having a disabled child on crack in your house that you really want to throw against the wall a million fucking times and bash it with the cast iron skillet. And Adrian thinks I'm saying something wrong, but I'm not. But I'm not, because it's an adult that you're doing it to. But I've never done it. But you want to do it because this person is an adult, and they should have common sense, and they should have dignity, and they should have respect, and they should have all this together, but their mind is warped. It's gone. It's been eaten with disability. It's been eaten with illness and sickness, and they don't see it. And they can't see it. Even if you explain it to them, guys. I've explained it to my grandmother, I've explained it to my mother. Neither of them have seen it. I've explained it to my aunt. She has not seen it. You can never make an ill person understand that they are ill. Here's the kicker: I'm ill, but I understand I'm ill because my mind is not completely gone yet. So I can accept the understanding I have an issue. My mind is not completely, but it's getting there. With everything I've gone through, it's getting there. And so that's why I'm making arrangements now, so if anything does happen, my family in that wake does not have to go through what they have gone through. Because I'm not going to put them through what they've already gone through twice. Because they went through what I did with their great grandmother and their grandmother. I'm not going to have them going through it with their mother. Because that's going to be 3 generations of psychopaths, and I'm not going to be a psychopath, and I'm not going to be a deranged, dementia ridden, crazy bitch. I'm not going to do that. I will literally bash my head into a wall and kill myself before that happens. And I know that sounds bad,
It does.
but I'm not going to do that to my family. And you guys got to understand why I'm saying this. But it is a phobia of mine. It truly, truly is a phobia. You need to understand it's a phobia, Dre, so you need to hush.
What I'm
Cállate.
trying to say is YouTube will get you in trouble for these
No, they're not, Dre. No, they're not. Baby, I'm not doing nothing to nobody.
It's words.
Words can kiss my ass. It's expression. It's what I feel. It's an opinion. Freedom of speech.
I'm sorry, but you guys can have that on YouTube. I'm just saying. You can
It's
continue,
an
but
opinion, Dre. Quib, you're chicken shit.
I ain't no chicken shit.
See,
I
I honestly, guys, I'm not saying nothing wrong with him, but he's worried that YouTube's gonna come over here and get a big old paddle and spank my butt, and I ain't scared.
They will.
Bring it on, YouTube. Spank me, baby.
Please.
You quit being a chicken. I like teasing them. I tease my children. I don't pick on them. I tease them. There's a difference, especially when he thinks I'm doing something so wrong. Freedom of speech. And I'm talking about myself, for Christ's sake. What they're gonna do, saying I'm, sitting over here talking bad about myself. So bad, Tabby. So
You're
bad.
talking about
So bad.
wanting to beat the shit out of people and stuff like that. I'm sorry, excuse my language, but that's pretty bad.
Because I say I want to doesn't say that I'm walking out of my house going to go do it. There's a difference.
Okay, listen.
It's an opinion. It's what I feel like doing. Doesn't mean I'm doing it.
That, though,
They can misinterpret whatever I'm saying. I'm not doing it.
All right, here's a hot take for you.
See, that's misinterpretation. Okay, I said it's something I want to do, guys. Doesn't mean I'm going to do it. And if any of y'all think I'm going to do it, y'all are idiots. Okay, that's a clarification. I'm not going to do nothing. Okay, because just like I said at the beginning of my video, I don't leave my house. And I said that at the beginning of my video. It ain't my fault you had your headphones in, son.
I have been listening.
And I love you. So bite me.
I've been listening to you the whole time. I'm not nagging at her, guys, or anything.
My child, he's abusing. I'm gonna take a line from somebody that used to live in my house. Stop abusing me. Sorry, that was bad. That was really bad. Dre, I was fucking with he's having PTSD, guys. See, that's bad. I just acted out what she used to do, and he is over here having a flashback. He literally looks like he wants to fucking cry. That is bad. See, that's bad. That is bad. And see, this is what I'm talking about. My child literally looks like he wants to cry, and I was just playing with him. I was just giving a little momentum and I was just acting. That was just because I've been in acting classes, okay? I've took drama, I've took acting because I did want to be an actress a long time ago, and that doesn't mean I'm gonna win an award for being an amazing actress or some shit. But besides me being an actress and I am working on writing, it is fictional novels, but it's horror stories, which my life is a horror story. Shit. But I just enacted what I've seen half of my life, but we're scarred by it because we've seen it and it's like so fucking fake, and it's like no tears, it's just enveloping the fakeness. So, and PTSD flashback, it's just like but anyway, this is what I tell y'all about the nursing homes, the DNRs, the hospice, the neuropathy, different things I'm teaching you about elderly people, okay? It's more that I'm teaching about education. Yeah, I teach about witchcraft, I teach about tarot cards and everything else, but since I've had life changes and life lessons going on in my life, I also want to educate y'all on different things too, because my life has gone through huge changes, and I know other people go through huge changes in their life too, and it's just like a wild ass spectacle. And I know other people go through the same sufferings, and it's like I've said, it's not fair that people have to go through sufferings like that, and they cry out for answers, and you can't always find the right answer. And then when someone gives the information to you and they share it, it's like, oh my God, where has this information been all my life? Where have you been all my life? Thank you for giving me that information. I share my knowledge of what I know and what I've learned with people because I've had hands-on experience and hands-on training, and I've been there. I've done that. And that's why I I tell my stories and I tell things I've learned. I don't want my channel just to be about, I don't mind being silly and joking and sharing other different things that I enjoy, but I also like sharing my other experiences as well. Because, like I said, if it helps someone get out of a bad situation, out of a rut, helps them figure something out for a loved one, gives them, profitable information or good information, or helps them make a good investment, helps them make a good family choice. I'm glad that I helped somebody do that because I enjoy helping people. That actually, it's satisfactory to me because it makes me feel good, because that's something I've always enjoyed doing all my life. Because when I help someone, it gives me that warm, fuzzy feeling inside. It always has. I feel like a teddy bear. I don't know why. It's just, uh, I've done that since I was a kid. It's just Alex, my youngest, he's the same way. Adrian at times is the same way. We just get that warm feeling when we help someone. It's just like, like Pillsbury Doughboy. You get that happiness. And it's my inner light that I have. And my husband even got worried that it's going to get diminished, that it's going to fade away, that it's going to get snuffed out. And that's why I had to make a stand for myself. I had to do what I had to do because my light was getting suffocated. And sometimes in your life you have to make hard decisions, and it's tough. It's painful. It's nerve-wracking. People like, well, you don't have to put people in nursing homes. Well, you don't have to do this. Well, you don't have to do that. Well, you don't have to kick someone out on the street. Well, you could do this. Well, you could have waited for that. Well, no. If it's for your own mental well-being, if it's for your family's well-being, so your family's literally not going insane and your family is literally not being drove to sickness, you have to make a stand. Okay? If anybody was in my home, if I had recorded everything, everybody would have agreed with me. And I had more people agreeing with me than I had more people disagreeing with me. I had my kids' doctors, I had people at my children's schools. I and it wasn't that because I was bad mouthing. I was just, giving for instances. Like, if this had happened to you, what would you say? And they're like, did that really happen? I'm like, yes. And I don't make crap up. Regardless of what my counterpart mother would say, I'm not trying to make her look horrible. I'm not. She has done good things in her life. Okay, I have helped her get her education. I have stood in her corner. I have backed her up. I have been her cheerleader. I have been her confidant. At times, you damn near could have been her best husband, if anything, because I treated her better than all the men that she's known. I was her best friend at times when she needed a best friend. I had, definitely given her good advice. I have listened to her when she needed someone to listen to. We have cried together. We have laughed together. But the thing is I could not take the abuse. I never abused her. Only time I hit her back is when I got tired of being her punching bag. You don't need to be anybody's punching bag. And I've said that 100 times and I'm saying it again. If you're anybody's punching bag, do not. Okay? She literally was treating everybody like a human punching bag. Everybody. And she finally, at the end, turned the one person that she looked up to, that she loved even more than me, my grandfather, into her last punching bag. That was a final straw right there for me. That was it. And that's not me saying she's a bad person. That's saying her mind was gone and she needed help because my family was putting things in her head. They were altering her memory and her mind was easily to get manipulated. And that's where I was like, I'm done. I can't deal with this. If your mind's easily manipulated like that, honey, you need help. If you're letting other people manipulate you that easy and your mind's that easily to get fabricated like that, I cannot be around you. Because you should know your father would have never done those things to you. He may have peeped on us, but that's as far as it would have went. He was respectful, dignified, military, good man. He would have given his life for everybody in his family. And that is what kicks me in the ass, that she even allowed her sisters to put down their father. She should have been like, you know what? I'm done talking to y'all. I'm done. You shouldn't even be putting down daddy. It was grandma. You shouldn't be putting down dad. We shouldn't even be putting down mom. You know what? We all need to stop this. We need to stop this cycle of bull crap. We need to quit talking bad about the dead. I've learned to quit talking bad about my grandmother. At times I get upset with some of the things she did, but it's like, you know what? I love my grandma. Yeah, she did some kooky wooky stupid shit, but she wasn't well in the head. I've learned to accept. I'm not saying bad things about her. I say she wasn't well in the head. Because someone's not well in the head does not mean they're a bad person. They're just not mentally well. That's not saying you're a bad fucking person. It's saying you're sick. That is a difference. And see, that is what my mom, Karen, misunderstood I was saying. Because I was saying, you're sick. You need help. She's sitting there thinking I was saying she was a bad person. And I'm like, because I'm saying you need help and you're sick. And a lot of the choices you're making and the choices you made was because of your illnesses. You think I'm saying you're a bad person? No. I'm saying the dependencies you've made, the choices you've let happen, the everything that's happened in your life, things that's happened to the kids and me were because of your mental illness. That's not saying you're a bad person. That's saying you had the same mental illness your mother had. That's not saying you're a bad person. It's saying you're sick. That's not saying you're a bad person either. It's saying there's wires crossed up here that's not right. They've never been right. And it's not that I was putting her down. If I put her down, I would never have cheered her on all the time she was in college. I never would have been like, fulfill your dream. Go for forensic, for the forensics. Go for the criminal justice. Go for this. Go for that. You can do this. I believe in you. You got this. You got this. You better not give up. Go do this. Go do this. Go do it. I even helped her do her own schoolwork. Second time I did it. I used to do her math homework for her when she was in college. Because she couldn't freaking do it. I could. I was doing it in 6th grade. I was doing her math homework. I helped her this time. And she got her freaking degree in her criminal justice. And I was freaking proud of her. But it didn't amount to shit because she couldn't do nothing with it. And I felt bad for her because I actually wanted her to do something with that degree. I actually wanted her to fulfill her dream and be able to do something. But she was held back by the mental choices that she made and a wrong choice that she chased because her mental illness was dependent on someone by a bad choice. And I felt bad for her. Yeah, there's anger there at times, but the anger that's there is because that's the inner child in me that cries out that wanted help from all the pain that I had to go through, from the abuse that I had to go through because of the man that she was with that was abusing me. He abused me when she wasn't around. He had hit me a lot. I said he touched me. When he gave me wedges, he gave me wedges from the front to the back. I was bleeding from the vagina to the anus. And he would grab me from the front sometimes, like his hand would touch my vagina. And I would try to tell her, and he would get in my face. So the inner child in me, she doesn't understand, is pissed. So that's when I tell y'all, when y'all make decisions, don't make it off of anger. Make it off of if it's the correct choice or if you're doing it off of your emotions as well. My choice was not off of anger, it was because that's what needed to actually be done because she was sick. Now, I waited until she got sick, 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 sick. I was putting it off, 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 putting it off. And you can ask my kids. I put it off for a long time. I try to work with her. And this is where you have to weigh how much. This is why I tell y'all it's what you legitimately can put up with yourself, psychologically, mentally, emotionally, physically, spiritually, developmentally. It's all what you can deal with. And you have to think about that. You also have to think about what the others around you in your surrounding area, if you have a family, what they can deal with. And you need to also come to a consensus and ask them, are you okay with this? Because it's not just about you, it's also about them, how they're being treated, how, things are going on with them, if they're being mistreated, and if things are going okay with them. You need to correspond with the other people around as well, because if they're getting mistreated, you're going to have to talk to your loved one and be like, hey, you're going to have to calm down, you're going to have to make some changes, you're going to have to, just chill out, and see if they correspond correctly. You're going to have to lay down some guidelines, some boundaries, and see if it works and make sure that they can behave. So do the things that you need appropriately, because it's not as easy as 1, 2, 3 chicken peasy lemon greasy. It's not. It's very hard. I tried to do it with her for about 15 years, and it was good for a while. For the last 5 years, it got horrible. Horrible. And I'm not, like I said, I'm not saying it because she's a bad person. I'm saying it because of the illness. It was rough because of her mood swings, the things that she would say because she was sick, of the behavior and the mental, her sleep patterns, the way she would eat, the way she would treat us when we were trying to look out for her, when we would take her out, the things that she would say. I mean, she wanted my youngest son to ask Popeyes if they only hired black people, and they heard her inside the store. And we got sick that night from the food. So we got food poisoning, no thanks to her. So she's highly racist, and are you okay?
Yeah, I'm saying I'm about to go to sleep. Continue with your video.
Oh. Um.
I'm about to give you the TV.
Oh, okay. But yeah, so
Make sure she doesn't fall while going upstairs.
No, I'm good.
are you gonna get the baby?
Almost fell over here.
Oh, he took the baby up there. Right?
Oh yeah, that's right. Okay.
And no, I'm helping her.
Oh, okay.
Good.
You said
Anyway,
I'm good.
that's pretty much it, guys. I gave y'all the full thing, full information. And I really didn't go off on a tangent, as I promised. I gave y'all some information so y'all can weigh it down as much as y'all can. Since Unknown has not came back and asked a question, I will go ahead and end this. But if you have a question and come back, you can post it down below. I will monitor the video, because I will hopefully be making another one this week if I'm feeling up to it. Because, like I said, I do have a doctor's appointment. Hopefully everything will turn out okay, and I am going to be making arrangements for myself, as I said, per per the video, because like I said, I am scared crapless. Night, baby, love you. um so yeah, I am making arrangements for myself, and because the boys in our family don't seem to have the issues, it seems the females only have the issues in my family. So it could just be a female gene only, it seemed like the females in our family seem to suffer the most. So it's horrible. Um, so it scares me to know its end, and it just makes me worry more that one day I might not be in my own mind or body, and it's a scary realization that I might just disappear one day and somebody else is going to be in here, and it's a terrifying thought and I don't like it. So it's things that I have to think about and consider. And my grandma did give a warning that one day that all of us may have to consider being like her. And I thought it was a joke, and I was like, man, we're never going to be like her. And she literally said everybody in the family, and I I didn't think she was laying down the law to all the girls in the family, but evidently she meant every single body in the family, because all my aunts have it, and all my cousins, well, except for my cool cousin that I'm cool with, she doesn't seem to have it, but mostly all my cousins seem to be having it.
No.
Good night, baby. Are you going Mimi's right now?
Yeah, I was wanting to like at least.
Well, I'm about to end it. I'm cutting it right now.
Okay.
Okay. But yeah, I will let y'all go. Y'all take it easy. I will hopefully do a review. I might start it alphabetically on movies. I don't know if I want to do complete spoilers on horror movies. I might do some TV shows that I've watched completely that were excellent, since it is Spooky Kooky Month. Those are gonna be like some of my fun things that I do, educate like horror stuff, since it's October. I will do tarot card, like I will do monthly or maybe weekly reading, like one card pull and do like that. But yeah, I'm gonna go ahead and end the video. I hope this was educational. Hope it helps somebody out if they're going through something like this. If you do go through something like this, my heart does go out to you, because I understand how difficult a situation is like this. And like I said, my heart does go out to you, and my condolences for you and your family for having a sick person. It's never easy, and I do hope that it does get better. And much love to you and y'all's families. And y'all have a good night, good day, good morning, good afternoon on whatever side of the world y'all are on. And I will see y'all in the next one. Laters.